Hello, everyone. Welcome to the Road to Recovery podcast. This podcast is a platform for education, discussion, and conversations on mental health. I'm your host, Amira Shah, and in this podcast, you'll get to know more about the therapeutic process, insight into life from the perspective of the psyche, and also join me in exploring current issues with other practitioners. I specialize in grief, but I'm always interested in learning about the human experience of the mind, heart, and spirit. So join me on this journey of in-depth learning about ourselves and the world we live in. Hi everyone, welcome back to Science of the Soul. I have with me today a special guest and a colleague, Pokala Kiara. She is a fellow counselor and she has her own private practice. It's called Marama Counselling. She practices here in Brisbane in Australia, and I'm really glad to have met her after, 2-3 years now. So hi Pokala, thank you for doing this today.
Hi Amira, that's okay. I'm very happy to be here.
I really enjoyed our catch-up earlier this afternoon. I can't believe I haven't seen you in so many years, but we've kept in touch over the years, and I'm really interested in how you've developed professionally and what your areas of expertise are these days.
Well, we did study together at the University of Queensland. Since then, I've worked with youths and teenagers mostly. And I've developed a special interest in ASD. I've also was personally diagnosed with ASD last year, which adds to that interest. So that's pretty much the direction I've been heading at the moment. I do see all types of clients, but yes, I have a special understanding around ASD.
Just for the listeners, ASD stands for
Autism Spectrum Disorder.
Thank you very much. And although it is a spectrum, we chatted earlier, you mentioned something about levels. Can you tell us a little bit more about that?
Usually during an ASD diagnosis, you will be assigned a level. The level describes almost your level of distress that you experience. So you can shift throughout the levels with therapy, with different things. Level 1 would be an autism spectrum disorder that didn't cause you too much distress in your life. It still has an impact. You still have the features of ASD. You're functioning quite well. Level 2, you're starting to have some marked distress. You're not coping quite as well. You probably need a little bit more support just to get yourself working in a manner that you are less distressed. Level 3 usually describes someone who has a lot of distress around their symptoms. Many level 3 children that I have met are nonverbal or have been nonverbal for a period. As I said before, you can move through the levels. Level 3 would just mean you would need quite a bit of support just to function in a manner that you feel okay and calm and less distressed.
And would someone on level 3 need to be for a child or a youth, in a different education system?
Usually that would probably be quite helpful to them. A lot of ASD people, including level 2, would need other supports like OT, which is occupational therapy, or speech therapy, behavioural therapy. They would benefit from seeing a psychologist who specialises in ASD, and different sensory tools and things like that can help them to calm their sensory system. Many people with ASD get quite overstimulated or understimulated. There is a spectrum with the stimulation. Some people are sensory avoidant and some people are sensory seeking.
Can I ask you a question about that? Is it possible to be sensory averse with some senses and what was the other one?
Sensory seeking.
Sensory seeking with some other senses within one person.
Yes, I think that is quite possible. Usually with ASD individuals, they would see an occupational therapist who would assess. So they fill out a survey, which is quite involved. It asks them a lot of different questions about how they perceive the different senses. So after they answered this survey, this questionnaire, that would give the occupational therapist information about whether they are sensory seeking or sensory avoidant with each sense. And it is possible to be sensory seeking with some senses and sensory avoidant in others.
Well, I trained in behavioral therapy, I want to say more than 10 years ago, so that's a long time ago. I'm sure a lot has developed since then, but I did applied behavioral analysis, and that's called ABA therapy. And what happened there was I worked with, I'm guessing now from what you're saying, I'm just reflecting back to my past experiences. Probably I worked with children and youth, so probably level 3s. And the reason why I asked that is because I remember that some of my students or my clients would seek for sensations like taste, or, she would put, like, for example, I had a client, she would put a lot of sauce in her food, like a lot of sauce. And later that led her to be diabetic at a very young age.
Oh, wow.
Yeah, she would need a lot of sugar, a lot of salt, in order to be satisfied with what she was consuming. But at the same time, when she was outside, she would be quite distressed from sound or light. I can't really remember what her main issues were back then, but yeah, that kind of confused me as a young practitioner at the time. I didn't really understand why one person could manifest in so many different ways.
Yes, and as you're saying, like, not all ASD people are the same. So not all ASD people will be aversive to light. I myself am aversive to light and sound, but not all ASD people are. Some ASD people like to make a lot of noise. That is part of their stim. A stim for an ASD person is a movement or a vocalization that helps them to calm down.
Yeah.
A lot of children with ASD will flap or clap. Some like to yell and have it's almost like a vocal tick. But it helps to calm down their sensory system.
Yeah.
But yes, all ASD people are very diverse, and I guess that's what the word spectrum implies.
So what made you resonate with this group?
Well, I didn't know at the start of my practice that I had ASD, but my little brother was diagnosed with ASD when I think I must have been about 19. He was nonverbal, so he would be a level 3 ASD when he was first diagnosed. I just really loved learning about what he liked to do and how he saw things. I liked that he taught me to be patient. I liked that he was different. It was very easy for me to get him and understand him. I love his honesty. He's very honest. Some people don't like that. It's a bit too honest, but I love it. He's very authentic. So he sparked my interest with ASD. Because he was nonverbal, I had to learn sign language to speak with him. And then he became verbal. As I said, you can move through the levels. He became verbal, and I loved the way he would vocalize his thoughts. There was no filter. He's now 14. he's still very cute. But yes, he was the one that sparked my interest in ASD.
And you mentioned earlier today that ASD presents differently in females than in males.
Yes, well, some of the features can be the same or quite similar, like what we were discussing before, sensory aversions and sensory seeking. But much of the literature and what we've learnt and we're taught at university is based around clients or people that present with ASD that are male. Females can be quite different, and mostly in their social, the way that they work socially presents quite differently with individuals with ASD that are either male or female. Females are more likely to mask. Males also do this, but females are slightly better at this. Masking is where you will pretend, almost, you will act in a way that you perceive to be more acceptable in either a social setting or a social situation, but it's not actually true to how you would normally portray yourself if you were alone or at home. Many girls hold it together at school and present a masked version of themselves, but will melt down later.
And when you're talking about this presentation, are you talking about level 1 or level 2?
Level 2. Level 1 would probably definitely participate in masking, even level 3.
Okay.
Yeah, it's something that a lot of ASD individuals can hold it together if they absolutely have to, but it's kind of like you'll pay for it later. Like there's
like a build-up.
Yeah, it's a build-up or like a crescendo. It's like it's there. It doesn't go away. Just because you can't see it doesn't mean there's no discomfort or that kind of thing. Also, girls are more social. Females with ASD are more social than males. Their special interests are also quite different. Many male children with ASD have very focused special interests. For example, my little brother's was trains, cars. That's all he wanted to do, all he wanted to talk about. Whereas girls, they could have a special interest that has a wider scope, like dance or for me it was fantasy novels. It's not as noticeable. My friend who has ASD, she had I think her special interest was an animal, like I can't remember which animal it was now, but she just had lots and lots of toys and stuffies of the one animal and she would collect them. So that's just a few ways of how they differ.
Do you carry the interests, these specific interests through life, or do they change?
They can change. My little brother is not interested in trains anymore. I think maybe he got sick of it because he was so into it. It was like he knew everything.
It was overkill.
There was nothing more to know. But like for me, my special interest, it can be endless because fantasy is just, there's so many different genres within that genre. I still enjoy fantasy novels.
Yeah. What's your fantasy novel right now? Have you got one right now?
Right now, I like to read. There's an author called Karen Chance, and she has 2 series. But the one I'm reading at the moment is set around a woman. She's a clairvoyant, but she's in the supernatural world. She's also the Pythia, which means the Pythia is someone that can travel through time and change history. She has to protect the timeline pretty much. But in this book, there's vampires, there's all different types of things. I just really enjoy it. She's quite good at storytelling. Karen Chance, and because you're going back in the future and back in the past and back up to the future, and then it's really involved to follow. So I enjoy that. It's not boring.
Okay. Sorry I cut you off.
That's
I was
okay.
just curious. And how they can change actually over time.
Yes, and like my friend I said before, she no longer needs to collect stuffies
Okay.
and teddies of this animal, but she has like other special interests now that she's older. Yeah, so they can change. They're not fixed. You can have more than one special interest. You can have a lot of special interests, but a feature of ASD is that they are very passionate about the things that they like. So they can talk for a long time about something that they like. And yeah, they can be obscure things or they can be normal everyday things.
Right.
Like they could be a Netflix series, but usually they will know everything.
This is a special interest that they've taken in a topic that I guess they're passionate about. Okay, so in the sense of how you work with them, can you tell us a little bit more about your practice?
Yeah, so for me and my practice, because I'm a counsellor, of course, I would be working around issues that they're finding difficult to process. A lot of ASD people find it hard to process situations that a neurotypical person would not really have any issue with. So if an ASD person does not understand why something has happened, it is very hard for them to move forward, and they can tend to ruminate on the same point.
Right.
Over and over. So my role as a counsellor would be to help them to process the issue that they are finding problematic. This can involve talking, re-experiencing with me, role-playing, that kind of thing, and just a little bit of psychoeducation around it. Something that they are having trouble processing might be because they're just not understanding an aspect of an issue that I could explain to them, or we could play out with a role play and that kind of thing. A lot of ASD people would probably just need to vent and talk it out, step it out and break it down to understand it a bit better. So yeah, there'll be a lot of things like that. Children enjoy play therapy. Yeah, different things like that. Puppets. I know my brother and other young clients I've seen, they enjoy role-playing their issue with a puppet.
Oh, hey.
Or a doll. And then that helps them to externalize an issue as well and not continually internalize it. But those are a few of the things that I would do.
And because the clients and children with ASD tend to be quite sensory averse or sensory, what was the other one again?
Sensory seeking.
I keep forgetting that. Sensory seeking. How do you maximize that in session?
So if I had a client that was sensory aversive, I would explore that with them. We could, if it was light, for example, we could explore dimming lights. We could explore how their body reacts to light and just getting them to notice these things, because sometimes you're actually not quite sure what aspect of the thing is triggering you or bothering you until you explore it. Right. For example, with noise cancelling headphones, because I suffer from sensory aversion to sound, I used to think it was the big noises that bothered me. But since having a tool like noise cancelling headphones, I've discovered it's all the underneath noises, like
the ambient noise?
Yeah, like a fan going tick, 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 or devices like TV, someone's phone, all of that at the same time. Because when you put noise cancelling headphones on, all of that goes immediately and you feel really calm. So we would explore what type of things make you aversive to that, and what type of tools we could employ to lessen the effect of that. With sensory seeking, you can explore different senses and sensations and tools that are safe for you to use. As you said, your client that you saw, it's not safe for her to consume that much sauce. Like, it led to health problems down the line. So you would explore something that would give them that same input that is safe for them to use.
Yeah. I wish I had the education and the knowledge that we have now when working with children with ASD, because they also are minors and they don't have that voice either. And
if they're level 3, some of them are nonverbal. They cannot express the way or articulate the way that we would be able to.
And I used to be, I was trained to positively reinforce her with the things that she likes. And a lot of that involved candy. And part of that, actually all of that didn't sit very, very well with me. I was happy to put on her favorite song or play her favorite game.
Yeah.
But I was just averse to continually feeding her milk powder or candies when she did something she was supposed to do, because I was doing behavioral therapy. Until I found out the result of how she was diagnosed as diabetic by 14, 15, which obviously impacted very poorly on me, because I had been caring for her and working with her for like 6 months or a year. I don't remember anymore. Time was warped.
And that would be upsetting for you. And it's not healthy for her. So helping them to explore healthy options is something else that I could do in session. Because even as an adult, sometimes I don't know what would be good to calm me down. But once I've thought into it and felt through all of it, that helps me to break it down. And as I said before, some ASD people have problems with processing thoughts. So it's easier to have a partner to break things down.
Sorry. So you're saying that you act as a sounding board?
Yes.
Okay.
Yeah, so a sounding board, or we can brainstorm, tease apart an issue or a problem, an aversion, and work towards a solution together. So I'm not just going to magically pull a bag of tricks out of my pocket. It's all about working with the client to find what works for them and why it works for them, and then they have that understanding. Also, in an ASD meltdown, it's very hard to think. Like, it's very hard to go, oh, what's going to calm me down? So if you know something will calm you down, you have it by you and you can use it straight away. That's much better than sitting there trying to think, oh my God, I feel really bad. What's going to help? Because you're probably not going to think that in the throes of a meltdown.
Is that something you explore with an ASD client, a client with ASD, in the initial parts, the initial sessions of your...
Yeah, I would probably do that in the initial sessions. Right. It would help to minimize distress.
Yeah.
And then that a lot of distress would be caused by aversions and sensory seeking. So once you minimize that, then a lot of thinking space would be freed up in your head. You're not dealing with the annoyances. You can deal with other issues that you may be experiencing. So that is probably something I would do in the initial sessions.
So I have 2 questions. The first question is, as a counselor who has been diagnosed with ASD, how do you find your experiences and your understanding most beneficial when working with clients with ASD?
Well, for me, some features of my ASD actually really help me, because one of my special interests is the brain and our behavior and why we do the things that we do. So when I study counselling, I retain that information. It's all there. It's something I'm interested in. It's something I always want to expand upon. So I find that really useful. I'm very thorough. I'm very particular. I'm very, everything is done very properly because of my ASD. I'm a perfectionist. So that's really helpful also. But having my personal experience, I can help a client better, I feel, because I know what it feels like. I have greater empathy.
Right.
And
You
compassion.
can relate.
Yeah, I can relate. But in a way that I can also help them articulate maybe something that they can't articulate, because I have felt that sensation before. Yeah, so I think it is actually a big plus. I didn't really feel distressed at all when I was diagnosed. I kind of felt relieved, and then it helps me in a lot of ways to have such a cool brain.
Well, I'm really glad that you've taken it very well. I personally would have no idea how I'd react if I received a diagnosis like that, because my only, I guess, experience would have been working with children with ASD. But you seem to have managed really well, so well that nobody knew, not even yourself, knew that this was, part of you going through your bachelor's, your master's.
It actually explained a lot of things that I had experienced or felt throughout my life. So it was, like a relief in many ways. It was good to have access to more information. Like when I was diagnosed, my psychologist specializes in ASD and ASD with women and females. I've learnt a lot from her about how it presents differently. I've also joined a few communities online. One of them is called Yellow Ladybugs. They have a page on Facebook, and it's all about ASD in women and females and girls. So there's a lot of really helpful infographics. I think it's run by a mother of a child with ASD who is female. And then there's a lot of other ladies in the comment sections that will post that either have female children with ASD or they are females with ASD. And many of them have been diagnosed later in life, like me. So it's also good to not feel alone in that. But, I don't mind being ASD at all.
That's really good to know. You have a very healthy relationship with, I guess, being diagnosed with ASD, because to you okay, correct me if I'm wrong, is it reaffirming your identity or part of you in a way?
Yeah, it's also making me feel like there is a reason for why I might be different to other people.
Okay.
Whereas before, you might feel a bit like an alien and you can't relate to anybody and nobody knows what you're talking about when you're trying to describe something. But when you're given a diagnosis, you can read more about that. You can look into it. You can find other people who have the same diagnosis, and everything just fits together, and your picture is made brighter and bigger because you've got
a better understanding.
Yeah, better understanding, more tools to use. I can learn from other people about what works for them for some things that might distress me or my clients. You can learn firsthand from people with diagnosis.
Hey guys, thank you so much for tuning in to Science of the Soul. This is a short interruption to let you know that if you or someone you know are in need of more support, you can find me at Road to Recovery on my Facebook page, my Instagram, or my website at aroadtorecovery.org. I hope you've enjoyed listening so far, and now let's get back to the podcast. My other question is, for counselors or therapists or psychologists, basically mental health professionals, we're quite trained in grounding techniques. We are trained in being able to alleviate acute distress.
Yes.
And some grounding techniques include breathing techniques, naming the things that you can experience with your senses, like what you
Yes.
see, what you hear.
What you feel, what you touch.
Yeah. So there are a few different techniques,
Mhm.
and I'm wondering if these grounding techniques translate in their effectiveness with clients with ASD in your experience.
They do. I find they're very helpful in the build up kind of phase. Like, so maybe not in a meltdown phase. It might be a bit too far gone for that. But in the build up phase, they can help to bring a more of a balance as things might be building up. And they're really good for the recovery stage. So after a meltdown, it's very good to ground yourself after that. I do a lot of like feeling tense and relief in your body. I can't think of the word right now. It's a relaxation technique. It's like body work. I can't remember the exact term for it, but it helps you to realize how your body feels when you're tense and how your body feels when you're relaxed. I've recorded an audio for that, and you can find it on my website. It's a free download. If you want to listen to that at nighttime, or if you were in a build-up stage to a meltdown, or anybody who's stressed out, really. I do some breath work as well, as you said. Yeah, all those grounding techniques I find are very helpful. I like to do them at the beginning of my day, just to like set the tone for my day. So it could be helpful for other people to do that as well.
I'd like to check it out. Is it a meditative practice?
I wouldn't. Some of them are, like on my website. I have a starting your day meditation, and then I have other ones that are exercises that you can either respond to me out loud while you're listening to it, or you can say it in your head, or you're moving your body, that kind of thing. But yeah, so they're all different types out there, actually.
I'd love to check that out. You have to tell us your website later, towards the end of the podcast, so that our listeners can check it out as well.
Awesome.
I had another question in mind. Just give me a moment. Oh yes. So how do you know how to tell when someone, when a client with ASD is in the build-up stage or the meltdown stage, or when they're close?
So for the build-up, that would be characterized by things like in children, they would become irritated. They might start moaning. They might start rocking back and forth. They may start picking at their skin or pulling their hair.
And this is the build-up?
Yeah, this is a build-up stage. Okay. They'll be restless. They might not listen to you. They might ignore you. For a child, a meltdown might look like screaming.
Yeah, a tantrum.
Laying on the ground, hitting their head on things, pulling at their ears, their eyes, that kind of thing. For an adult, a build-up would maybe quite similar, like presenting quite irritated, almost manic, as in like can't sit still or not satisfied by anything, like just very cranky, or anxious, very anxious, worried expression. They might be jigging their leg a lot, or they just look uncomfortable. And in a meltdown, it can be quite similar to a child. Even in an adult, you can lose control of yourself, hit yourself in the head. I've seen adults do that.
That must be distressing even as a practitioner to observe.
It would be stressing to observe that. I find it harder to watch an adult because you're kind of used to watching children have... While tantrums are not meltdowns, they're quite similar. So it's distressing whether it's an adult or a child, but it's almost, you kind of feel a bit hopeless with an adult. But I find when you're in the build-up phase, if you can tamp that down a little bit and help them to relax and not reach that meltdown phase. It's quite satisfying. But it's also, I actually, enjoy is not the right word. I like to be there to support someone after a meltdown. Because as an adult, there are a lot of feelings of shame if you experience a meltdown because of that loss of control, and perhaps you've done something embarrassing like hit yourself or throw yourself on the ground or curl up in a ball. Many adults feel a sense of shame or embarrassment. But it's quite nice to be there for someone who's experienced such distress and just help center them and calm them again and let them know it's going to be okay. Like, these things happen. Even neurotypical people have meltdowns, road rage, things like that. But that's what a build-up may look like and what a meltdown may look like. They're quite different. The distress is much more marked in a meltdown than it is in the build-up. But they're still both uncomfortable for the person experiencing them.
It sounds like you really have to create a very safe space.
Yes.
And we already do that as therapists, but for working with clients with ASD in particular, that space has to almost be sacred.
Yes. And very, very safe. And an adult may not disclose to you something that they find embarrassing. So they might be suffering with this kind of thing a lot. But it's more than okay to talk about it. And the more that you talk about things, the more support you can get and figure that out. But yeah, as you know, any space with a client has to be safe.
Yeah.
And we are there to hold space for them and whatever they bring to us. So yes, I take that very seriously, and I'm sure you do too.
Yeah, I do. I was just wondering while you were relating the differences between adults presenting with the build-up and meltdown, what comes to mind, because I am quite visual and imaginative, so I tend to vividly imagine everything that's being explained. And what comes to mind is, how do you ground yourself when you are in the presence in a therapist role of an adult experiencing a meltdown or a build-up?
For a build-up, I would just present in a very calm manner.
Okay, just to model
what. In it also, as you learn in counselling, when you're in a room with just one other person, you'll usually start to act a little bit more like that person. So if you're that calm space for them, they will tend to become a bit more calmer. Everything feels calmer, so you're kind of gravitating towards that and you're becoming in alignment with that. During a meltdown, there's probably not much you could do to stop it in its tracks. It would kind of have to play out. So just being there as it played out, probably not touching, that probably would not help, especially if someone was sensory aversive. Just talking in a calm manner or just waiting patiently until they're ready to talk, offering a hug or something calming afterwards. Even like a drink of water. Some people like to I wouldn't do this in session, but if they were at home after a meltdown, have a shower and wash those feelings away. You could do a relaxation exercise if they were open to it afterwards. Just holding space, and if they need to vent or talk about it, or if they don't want to talk about it, just following your client's lead.
So being really client-centered.
Yes, and like we learn when you learn about mental health first aid and how you would approach someone in a situation like that, that's probably how I would approach someone who's just had a meltdown or is experiencing one in front of you. It's not quite common for it to happen in session. It's usually more of a build-up type of scenario because of the masking. Many people will have a meltdown in a place that they feel safe. If they felt safe with you in session, they may do that. And children are more likely to do that, but many adults usually will not have a meltdown until they're at home. They'll try and hold themselves together until they're at home, or if it does happen in a public area, it usually triggers a lot of shame and embarrassment afterwards. But yeah, I have yet to experience an adult meltdown in session. But yes, I would just continue to be a safe space if that was to happen, and approach from a mental health first aid perspective, which is, lower your voice, talk very calmly, ask calming questions, grounding questions, help them breathe.
I already feel calmer. Yeah. You're mirror. There's a lot of mirroring happening here. Yes. Well, is there anything else you'd like to share with us that you think would be useful for our listeners to know about people that they know with ASD or counseling with ASD?
I guess for me is, if you have any suspicions that you might have ASD, act on that. So visit a psychologist that specializes in ASD. You can use Google to type in that kind of thing. Get an assessment for yourself. I always felt I was different. I didn't realize how different. But having that diagnosis, some people are, I think, afraid of the label, but having that diagnosis has enabled me to access more support.
Right.
So I am able to use things like, in Australia, we have the NDIS. So I can access that, and I now have support, which was greatly needed. So yeah, that kind of thing. Even for your child, the same thing goes. You can have a whole bucket load of support that you may not have even realized was available to you. And your NDIS can help you with things like therapy, help you to pay for therapy, whether it be counselling like what you and I do, or occupational therapy. It can help with things like housework or helping you go to an appointment. There's a lot of things you can do with that. So yeah, that would be, kind of my advice. Yeah, don't be scared of it. It's not a bad thing.
It just sounds like a different way to live.
Yes.
This is a different presentation that requires different strategies, really.
Yes.
Thank you so much for Carla.
Thank you for having me.
I've had a really nice time, and I wanted to ask you to share with our listeners your website.
So my website is www.marama.counselling. So it's MARAMA counselling.com. 2 L's.
2 L's.
Australian spelling.
Just checking. So that's www.maramacounselling.com.
Yes, correct.
So check out her website. She is a very competent counselor. I know that for a fact. And until next time. So if you or someone you know might need counseling support, whether in ASD or any other areas, feel free to contact either of us.
Yes.
And we'll be more than happy to assist you. Thank you once again.
Thank you.
Until next time. Bye.
Bye.